Are you experiencing dryness over there? Well, the vaginal dryness can cause irritation, burning, and the pain during the intercourse, while it's common after the menopause, and it also can happen in any age group. This can be caused because of the low hormone level, also in females. At the time of the menopause, your body makes very low estrogen, which causes thinning, drying, and the inflammation of the vaginal walls. This is called vaginal atrophy. Low estrogen and the vaginal dryness can happen at other times. Estrogen level can fall after childbirth, after along with the breastfeed, and during the cancer treatment or with the anti-estrogen drugs. There are non-hormonal factors, cold and allergy medications are also there, which may also cause the vaginal dryness. And there are certain drug syndromes are also there, or maybe sometimes the autoimmune diseases, who may result into the developing of the vaginal dryness in a female. Dryness is not always just inside the vaginal canal. It also affects your external genitalia, that includes your vulva. So that's why most of the time women started to feel irritated because of the vulval dryness. Meanwhile, they are putting the underwear. So you may notice the irritation meanwhile talking to them. Some women also have increased UTI along with the vaginal dryness. UTI is a urinary tract infection which results into a severe complication sometime in females. So if you look at the treatment, then you can combat your vaginal dryness with the help of the OTC medicines, which includes your lubricants also. So there are the two type of lubricants, that is internal and the external. Internal is basically for the vaginal moisturization, external is for the external genitalia. So I prefer the water-based lubricants. Estrogen creams are also there, tablets are also there, which needs to be inserted few times a week into your vagina. And vaginal rings are also there, which needs to be placed into your vagina. So these are the few solutions for to treat the vaginal dryness. Other than that, if you're having the very regular vaginal dryness along with the itching and the redness and the rashes over there, then definitely you should consult to your gynae as soon as possible, because it may be a sign of a fungal infection. So this was all about today's video. So I hope you like this video and you have subscribed to my channel for the more upcoming content. Thanks for watching and see you in the next video.